Ready to go? All right, everyone. Well, welcome to the Brawley City Council, successor agency to the Brawley Community Redevelopment Agency. Our regular meeting agenda for April 18th at 6 p.m. here at the City Council chambers. And if we can have roll call, please.
Yes, Councilmember Hamby.
Here.
And Councilmember Revelar is absent. Councilmember Wharton.
Here.
Mayor Nava.
Here.
Mayor Pro Tem Castro.
Here.
All right, thank you. And Councilmember Revelar is out on city business at a Southern California Association of Governments meeting, so he's out representing our area and our city, of course. So thank you for that. The next item on the agenda is the invocation. If I can have Councilmember Hamby lead us in the invocation, please.
So I'll stand if you're able. Bow our heads and pray. Dear God, we are thankful to you tonight for your many blessings. We thank you for the opportunity to guide our city, and we ask that you would give us wisdom this evening. You would oversee our proceedings. We thank you for each person that makes an effort to be here, to be involved in their city government. We thank you for just each person that works for the city of Brawley, that puts their efforts and their hands toward making this a better place to live. We ask that you be with us tonight, that you would continue to bless this city and keep us safe. Heal those that are sick, comfort those that are experiencing loss. Be with us tonight. In Jesus' name, amen.
Thank you very much. You can please join me in the Pledge of Allegiance. Ready? Begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you all very much. Next item on the agenda is the approval of the agenda. Is there an approval as written?
I'll make a motion to approve as written.
There's a motion. Is there a second?
Second.
There's a second. Any discussion? All those in favor, please say aye.
Aye.
Any opposed? Motion carries. Thank you. Next item on the agenda is public appearances, comments not to exceed 4 minutes. This is the time for the public to address the council on any item not appearing on the agenda that is within the subject matter jurisdiction of the city council. The mayor will recognize you when you come to the microphone. Please state your name for the record. You are not allowed to make personal attacks on individuals or make comments which are slanderous or which may invade an individual's personal privacy. Please direct your questions and comments to the city council. Is there anyone here who would like to make a public comment on any item not appearing on the agenda? Please.
Good evening, members of the council and community members. My name is Guillermo Hernandez, representative for Assemblymember Eduardo Garcia. I'm here today to briefly discuss AB 918, which proposes the expansion of the Pioneer Memorial Healthcare District to include all of Imperial County. As many of you may be aware, the healthcare barriers faced by residents of our county are well documented, and this bill offers a promising solution to these challenges. However, I want to stress that we are committed to transparency and openness throughout this process. If you have any questions or concerns about the bill or the expansion of the healthcare district, I encourage you to reach out to our team or to myself. I will be leaving my business cards and the latest version of the fact sheet for the bill here tonight, and we welcome any feedback or input you may have. In addition, please know that we're available to meet with you in person at our Imperial office, or you can reach us via email or phone. We want to ensure that the community has a voice in this process, and we're here to listen and address any concerns. Thank you for your time, and please don't hesitate to contact us with any questions or feedback. Thank you.
Thank you. Thank you very much. Is there anyone else who'd like to make a public comment on any item not appearing on the agenda? Seeing none, we'll move forward. Thank you. Next item is the consent agenda. Items are approved by one motion. Council members or members of the public may request consent items be considered separately at a time determined by the mayor. Is there a motion to approve the consent?
Mr. Mayor, I make a motion to approve the consent agenda.
I'll second.
There's a motion and a second. Any further discussion? All those in favor, please say aye.
Aye.
Any opposed? Motion carries. Thank you. Next item on the agenda is the city manager's report.
Thank you, Mayor. I have 3 items briefly here. First item is the spring cleanup this Saturday from 8 to 12. With just a reminder, it's at the Imperial landfill in the dump there in Imperial. typical things that you can bring and can't bring are up on the screen there. Again, that's this Saturday from 8 to 12 p.m. And I believe if you're heading that way, you have to have your water bill and a valid ID. Plus, I believe it has to be tarped. So that's one announcement. The other announcement is more of a public service announcement. This Friday, April 21st, in the elementary school district vacant lot over here is the Brawley Feed the Need Community Festival. It's, of course, hosted by Brawley Feed the Need. It's a small concert, Christian-themed music, and youth activities. The event is from 1:30 to 8:30. Street closures will begin on 10 p.m., but the street closures are really basically the alleyway behind it, and that entrance into the school district there, that's technically D Street, but it's just a dead-end street there. That's the extent of the street closures. Public Works and Police will be putting out their electronic trailers to let people know of the congestion that possibly could happen there on Friday afternoon. And lastly, but not least, is I want to mention a big thank you to Rachel and the staff, all the city staff, and the many volunteers for a wonderful Easter event. I believe the mayor was there, and I'm sure he'll have more comments about that later, but it was a wonderful turnout and a lot of hard work by all those folks. And that's the extent of my report. Thank you.
Thank you very much. I appreciate that. Next is regular business, discussion and potential action to approve travel to Sacramento, California, and expenses for library manager Petra Ortega and supervisor clerk. I always mispronounce her name, I'm sorry, Ms. Ortega, to attend the annual California Library Association conference presented by Petra. Is there any questions from council on this item?
No, I think it's pretty straightforward, and I have no questions, Mr. Mayor.
Is there a motion to approve the item?
I'd like to go ahead and move forward and make a motion.
Is there a motion to approve?
Mayor, sorry, after this, I have a comment.
Sure.
Yeah.
There's a motion and a second. Any additional comments?
That's not on the second.
Okay, perfect, all right. All those in favor, please say aye.
Aye.
Thank you.
Motion passes, thank you. See, that
Just-
was short and sweet.
Just a clarification on my report. I said this Saturday, April 29th, but this Saturday is not April 29th. It's
Okay.
the Saturday, April 29th.
There you go.
On the
Okay.
spring cleanup. Apologies for that.
Thank you. I appreciate that as well. You know, I appreciate that. All right, next item on the agenda is discussion potential action to adopt resolution 2023, accepting grant funds from the State of California Citizens Option for Public Safety, COPS, fiscal year 2021-2022, an expenditure plan through the State of California Local Safety and Protection Account presented by Jimmy Duran, Chief of Police. Chief Duran, you're up for the next couple of items. You're looking slick today, by the way.
Oh, well, thank you. Appreciate that. Well, good evening, Mayor, members of the council, city staff, city manager, Jimmy Duran, Chief of Police. So I'm coming to you with this request to accept a grant that's from the state, what we call state COPS, also known as California or Citizens Option for Public Safety. And this is in the amount of $173,756.19. And this is for fiscal year 21-22. So today I would ask that you approve the award, and given our budget that we have here, which is for police and communication equipment, training and services. And in the report, we have attached a copy of the resolution, as well as a copy of our expenditure plan, and that's all the county requires to release these funds.
Fantastic. Thank you, Chief. Is there any questions from council?
Mr. Mayor, again, read the backup material. Happy to go ahead and let's approve this item and move forward.
So that's your motion?
That's my motion.
There's a
as
second here
presented.
somewhere?
I'll second.
There's a second as well. Any further discussion? All those in favor, please say aye.
Aye.
Any opposed? Looks like you're in luck, Chief. Motion carries.
Well, thank you. Appreciate that.
Thank you. Next item on the agenda, discussion potential action to approve request for use of development impact funds to remodel an area of the police station to accommodate the growing needs of our community. Presented again by Chief Duran.
Thank you. Good evening again. And this is a request to use what we know as DIF funds, or Development Impact Funds. And this to remodel an area of the police station, and this to accommodate the growing needs of our community. As you know, our community or population continues to grow, and our facilities are being outgrown. And thank God we've been able to keep personnel now. We're actually hiring more, and we're moving forward. And with a task force that we have in-house now, we have 3 additional agents and 1 National Guardsman. And we are hoping that in the near future, we will have 3 additional agents from different agencies. So we continue to grow, and the needs of the community continue to grow. And let's face it, our buildings are so old, they're antiquated, they were not designed for what we are using them. So I'm suggesting that we do a remodel. In this remodel will give us 2 additional conference rooms. And you may say, well, you already have one, but unfortunately it's in the EOC. I'll give you an example. Today we had a narcotics operation. We couldn't even brief. We had to pretty much brief in the parking lot. We couldn't use the audio and visuals because individuals were using it. Not because it's bad, but it's just an example.
Right.
We had interviews as well today, and we had to do them here. We couldn't do them at the police department because the conference room is attached to the EOC, so unfortunately we couldn't do that either. And there's been multiple times when other departments also use the EOC. And again, our only conference room is attached to the EOC, so when it's in use, it's pretty unfortunate for us. We cannot use it. So this remodel would actually do, again, 2 small conference rooms. One is going to be attached to the lobby. That way we can meet with the community immediately. As you know, some of these small meetings sometimes are better, more effective than the bigger ones. And having our community liaison officer now active, we're hoping to draw more people. And the second conference room is going to be in the interior. A lot of times we get individuals from other agencies. For example, from Post comes and does an audit every year. Sometimes we don't have a place to put them, and we have to just provide them a desk in the corner. Just different multiple needs that we have. In addition, what this is going to call for is to move the admin assistant. She currently works in a cubicle, which is pretty much sandwiched in between all command staff. So we have the water there, we have a copy machine, we had other devices there that are in constant use, and it is very hard for her to work. So we wanted to take advantage of the movement and produce a small office. We do have the space, the real estate. We just have to reaccommodate everything and kind of like move things around to get our purpose here done.
It's just a better use of your space and the layout. I walked through it recently with Mayor Pro Tem Castro, and it does look like every ounce of space is being utilized, but you did mention at that time too that the same concerns you raised today was because the EOC is a large space, but it's used at different times by different groups, and it may not accommodate what you're trying to do right away. So that's good.
Yeah, no, I remember that very clearly, and how you guys are maximizing the use of all the space there, but also the need to protect victim privacy and whatnot, and some of the issues. So good. Glad this is in front of us.
Really, I guess, Mr. Mayor, if you don't mind, just for clarification, it's not even really a question. I think a couple of support documentation in there with the account summary. Just to be clear, I know sometimes development impact fees are met with a certain amount of scrutiny, rightfully so. Just if I can ask our city manager or chief just to briefly explain that these funds are clearly an item that can not only come from that, but there's a specific amount, I think, that's listed.
Yes.
That's already budgeted.
I believe we did attach the budget. So we do have enough funding there.
Yeah.
I did some research, and DIF funds are meant for this purpose. They're meant to accommodate when population is growing, and we're establishing new programs. For example, the community liaison unit, which we didn't have before, and now they need a place to meet in at the police department. So that's really going to accommodate that. And if you read my staff report, I actually include part of what those rules talk about. So it says that these rules are assessed on new developments and are intended to offset the costs associated with growth. And pretty much for me, that was the key. Our community has grown. Our police department is expanding. We are providing a lot more services. We didn't have a task force before. We did not have a community liaison unit before. So these are the kind of things that we have to accommodate. We are providing new services. We are growing. So it is my opinion that it does meet the requirements associated with the use of DIF funds.
So this is exactly what these funds are for. So thank you, Chief.
Yeah, the impact fee study was done, I don't know how many years ago now, and there's within that study, there's broad projects that are mentioned in that, and one of that was the improvements of the police department facilities, and I do believe Carla, our former finance director, was part of the beginning of this process to verify the use of the impact fees. So,
Thank you.
Mr. Mayor, I'll make a motion to approve this item.
There's a motion. Is there a second to the motion?
Second.
There's a second. All right. All those in favor, please say aye.
Thank you.
Any opposed? Motion
Thank you,
carries.
Chief.
Thank you, Chief. All right. Next is presentation. I'm not sure if our presenter is here yet, but I think they were scheduled to come in a little later. We'll move forward with the agenda, and we hope that we do have time for our presenter as they arrive. And if we don't, then we can move forward into closed session. Okay? All right. Here we go. Next item on the agenda is information reports, monthly staffing report. It's there for your view. And we'll move on to city council member reports, and we'll start with council member Hamby.
Thank you, Mr. Mayor. Just a couple of things. I was honored to attend the ribbon cutting at Ivy Respite, the Santillan and Alcantara families, and had the opportunity to speak on behalf of the city and the mayor. Grateful for their participation in our community and their beautiful office that they have built there, that here in Brawley, that they could have built anywhere, but they chose Brawley. So it makes that part of town look even better. And the services that they provide are definitely needed throughout our community for those with special needs and their families. I attended a library board meeting. Those are always exciting, riveting, and there are people on that board who really care about what's happening with the library and have been involved for many years. So, and then I've got to have some conversations with different department heads, notably the police chief, Jimmy Duran, about upcoming projects that he's working toward and grants that they're applying for. And it's encouraging to see, the efforts that are being made within each department to expand, to provide more services and to do more with what they have right now as far as income goes. So it's, there's a lot of encouraging things happening in the city of Brawley, and we've been on a trajectory of, positive things happening and things getting better for the last couple of years. So I hope and pray that we can continue that, in spite of the challenges that are thrown at us every week, it seems. So that's it for my report. Thank you.
Thank you, Councilmember Hamby. Councilmember Wharton.
Yes, Mr. Mayor, thank you. I'll be brief here. Did over the weekend attend, it was a social event, but a big celebration for one of our Brawley families in the cattle industry. But many folks attended. It was an anniversary, 40th anniversary, and had a great time and a lot of good interaction with folks. Again, got to share what's going on with the city and also receive some positive feedback on overall how things have certainly have been going, most of which I think we highlight and talk about, including I think some of the things that our chief of police was recapping. But I just wanted to share that openly. Outside of that, have some conversation I'm working on with our city manager in ongoing conversations with SDSU. I think all of us have interaction at one point or another, but I know some of this is stemming from the conversations that started a few years back. And as things are kind of heating up, I have a personal interest in some of the STEM programs, the nursing, potentially even things that can relate to EMS and pre-hospital, that type of education and training. And so excited about that. Speaking of which, just on a related note, coming up in May, I'll have the specific dates on our next meeting, but EMS week is coming up. And I also like to mention something about it. Usually it's the week of, but I'm kind of a little bit early this year. Chief, I know as that's upon us, usually at the county level, there may be some events that might come together, some of which we may be involved in. So more to go. If something comes together, Reach Air Medical may host something. And then lastly, I do intend to go to the collab breakfast. I think that's this Friday morning at Stockton's as well. That's all I have, Mr. Mayor.
Thank you very much, Councilmember Warden. We're going to Mayor Pro Tem Castro.
Thank you, Mr. Mayor. Yeah, I had a busy couple of weeks myself. I attended this past week in the Eric Silva annual memorial golf tournament for a Marine who died in combat in 2003 during the invasion of Iraq. Interestingly enough, I ended up teaming up with a fellow from Department of Homeland Security who has personnel who are sharing resources with the city of Brawley. And so he discussed, what a success it has been for them, as well as, for us, right? To share resources and obviously how much they've been able to accomplish, working in collaboration with the city and city police, Brawley Police Department. We then went over to Chavela Fest. Chicano Correctional Worker Association had their event. It's a fundraiser that it helps. They raise money for scholarships and to help people in the community. It was put on by Saul Rubalcaba. Saul Rubalcaba was one of the key individuals who was helping when we were building that restroom here in Brawley. Oh, so you need to read it? No, I'm sorry. I just keep looking at it like do I need to read it? No, okay. And then, but last but not least, I've been having a lot of conversations with Mrs. Katie Santillan, who is the chairman of Pioneers Memorial Healthcare District Board, and also which led to a long conversation today with our Assembly member Eduardo Garcia over the bill that was presented today by Guillermo, AB 918, the expansion of Pioneers Memorial Hospital. I expressed many times that I would not support anything, and I would hope that the rest of us wouldn't support anything that would force us to take on the debt that El Centro Hospital has taken on over the years. It's been grossly mismanaged, right? And then they're about to shut down. They're doing a little better. They're $190 million though passed on to the rest of us wasn't acceptable to me. According to the language here in AB 918, this passes the responsibility to local folks who would see 2 folks from Pioneers, 2 from Heffernan, 2 from El Centro, 1 individual appointed by the county. Those 7 individuals would then decide on how they would absorb the El Centro Hospital, the assets that Heffernan, that Pioneers has, and the ones that El Centro has. But also, they would also be the ones to decide how much debt would they settle. 25%, 50%, 100%. But ultimately, control would be passed down to us here in our community, which is what I'm a big proponent of. We need to control this. But at the same time, we have been unable to come to terms to an agreement between all these districts to make this happen. And the ones that are suffering are the folks in our community. We need access to good health care. And often we find ourselves going to San Diego, to Palm Desert, and other areas to access better, higher quality healthcare. And it needs to happen here. With shared resources, we could do a lot more, and we could have a lot more provided here for our folks here without having to go over the hill every single time. So I think we should be looking at this as a positive move, head into 1 district, and obviously with local control. That is key, local control. Once this interim board is appointed, then, obviously elections in 2024 and elections in 2026, and it would be handed over to a board that would represent all of Imperial County. And that is all. That's all I have. Thank you.
Thank you. I think our city manager has some comments he'd like to share from Councilmember Rivelar. Is that correct?
Thank you. Yes.
Can you do it in his voice?
No, I'm not very good at impressions.
Oh, okay.
So.
You got to do the hand thing too.
Yeah.
That would be good.
He states, "Good evening. Due to being at the state capitol, I will save you from another one of my 10-minute-long council member reports. I am currently in Sacramento with SCAG, that's a Southern California Association of Governments, Executive Administration, and other Southern California elected officials on lobbying efforts to protect transportation budget priorities, the state's support of local and regional efforts, and additional flexibility for local jurisdictions to address the state's housing crisis, and the modernizations of CEQA to preserve the intent of the law while limiting abuses. Thank you all for participating and those in attendance for your civic contributions, and hope to see you all at the next meeting. Council Member Revilar.
Thank you for those comments. Thank you for sharing. All right, so I'll keep it brief. I briefly attended the Ivy Respite grand opening. I showed up late, a little late, and I do appreciate Councilmember Hamby filling in there. I had a last-minute change in schedule that I had to address things at, but I was able to show up for a moment, and wonderful facility, great family, a lot of people, and a big celebration. I think they employ multiple hundreds of people, so that's good, and it's throughout the state of California. I also attended, and I do want to thank city staff, Rachel and Parks and Rec, and Brawley Fire, Brawley PD, and all the other staff members, and your crew, Rachel, and everyone else who helped on the Easter event. That was very well attended. It was a hit with the kids, and I'll tell you, there was 7,000 eggs out there, and there was a lot of kids out there, had a good time, and it was just there's music, and the Easter Bunny showed up on a bicycle, and they thought maybe they were going to fall off the bicycle for a moment, but they didn't, so that's good. Easter Bunny made it through. And so, no, it's just a good event overall, and I'm glad that the community's out there engaging themselves, participating, and taking advantage of the fact that we do have these events for our kids in our community. So thank you to city staff. Thank you all very much. I also do want to thank, on a personal and professional note, would like to thank city staff for their assistance. I'm in the process, as some of you know, of opening a new business in Brawley as well, and it's just been eye-opening experience. I have other businesses in Brawley, and it's been about 5 years since I've opened a new one here, and it's just been a long process for me, about 5 months of work, and it's near the finish line. But I mean, I'll thank the people certainly publicly when that time comes, but I do want to thank city staff for their involvement, their engagement, and their assistance during that process. It requires multiple people, multiple departments, and it's been a good experience, and I hope that other business owners and other business people have that same experience, and I'm very confident that they do. This is a smaller project, of course. It's not large development, but it's still meaningful to me, meaningful to the people around me, and and even city staff, they like to see things develop as well. So thank you all very much.
Mr. Mayor, I would like to just point out that a study that we had done in the last 2 years, and data that firm showed, is that small businesses, especially in the downtown corridor, often provide more revenue to the city per square foot or per block than the big box stores with the huge parking lots that don't bring in any revenue in those areas where cars are parked. So it's no small thing to open a small business.
Well, I appreciate it. Thank you. I mean, you've been there, and Councilmember Castro's also been there. Mayor Pro Tem Castro's been there.
And I bet your neighbors are happy. You just
they're
raised
happy.
the property value all around you.
I mean, we'll talk about it more in person, like once we open and everything. But I'm excited about it, and it's been a labor of love. I'll tell you that much. It's just been a lot of work. So I'm happy to see it flourish, and thank you all very much for your support. One thing I would like to mention as well, and this is a little bit, I met with members of the police officers union, and they were just, they realized that we have some challenges within the department with respect to recruitment and retention, and so they approached me about, the potential of having some maybe conversations about sales tax measures in the future, and it's something that we've talked about, and I think I would like to explore that. I know we do have very good data, and I think that maybe some of the companies that we've contracted with could provide maybe some examples of what it would look like, much in the form of like El Centro having a sales tax measure. Although we don't have the sales base that they do, we do still have a sales base, and I'm hoping that maybe that's one thing we can explore. They also talked about just shared with me, maybe the potential for sort of much like March and Ash type of cannabis type of thing. I'm not maybe a proponent of that, but I'm willing to look and explore anything. Obviously that can help our city.
They're in favor of it.
Right. Well, it's one of those things that we'll see if we can have good information. I think it's just at the very least professionally we can consider the things that we have. So anyway, that's a conversation, but I did want to point out the sales tax topic. I think that's one we need to have soon. I think for all of our sake, just to see how we can function our community and our city and continue to grow and meet the demands. So,
Mr. Mayor, we had a public workshop last year,
right,
on finance where that and several other ideas were put out. So.
Yeah, Mr. Mayor. Also, we had looked at this not too long ago, right? Maybe about 4 or 5 months ago. That's why I brought it up a couple of weeks ago. So maybe you can bring that back, Tyler. I know that there are some studies already and some numbers already presented.
Well, we have sales data. I mean, I think if we can use that and then maybe some projections from some of the companies, even if it costs money to get them, I think it's valuable information that we would be able to have. So anyway.
And now's the time.
Yeah, thank you. And so that leaves me to our city attorney report.
And I don't have a report.
He doesn't have a report. All right. So,
Mayor, Mr. Sorensen said he's about 5 minutes out.
all right. So we can maybe take a little 5-minute break, and then we'll wait for his presentation, and then we'll go into closed session. All right. So we'll take a little 5-minute break if you would like. Use the restroom. Yes.
Can I ask a question?
Sure.
Is there something that we can do about our streets and not being able to see the lines on the road? It's really bad.
There is. What are there any streets in particular that you were
Main Street.
Main Street?
All the way down Main Street, you can't see the line.
Well, we do have some things in
It's
my,
horrible.
in show, and that we've heard that before, and we've waited a little while to get that work started, but we're in that process now. So
Yes.
you want to,
And
yeah.
the streets are so bad.
yeah,
Yes, that's all part of the Main Street project. That's about, it's $6 million that we finally got all the funding together when we tear up the streets and redo the infrastructure. Then, yeah, that's definitely a part of the scope.
yeah. You can come up and say something, please. Let's keep the level of decorum. I know we're on break, but please come up and address yourself.
All right, my name is Jesus Calderon. I live right at the Ciudad Plaza, right across the street from the fire department. I guess you guys opened up a new club or something. It got way during the week. During the weekend, it's loud. It goes beyond 10 o'clock all the way to 2 o'clock. It's just real quiet. At that time between 10 and 2, it gets real. You can hear it real loud. And then during the week, they have it going on too, and that's ridiculous. I mean, nobody would like to have nobody bumping their music in front of nobody's house right now at that time.
All right, we appreciate the comment, brother.
Yeah.
So we have.
How do you guys address that?
We are working on finding a resolution for everyone, and just so you understand, we don't open clubs. We didn't open a club. It's a private.
It's only obvious courtesy, that.
I understand, but I'm trying to make something clear. The city doesn't open clubs. It's a private company that has, and so the challenge has been, it is in a downtown specific plan area. It is a downtown business. It is a restaurant and a bar, and so and we also have mixed use housing. We have other things in the city, so it's a little bit of a challenge for all of us here, and we're trying to.
It's outdoor and it make it like a tunnel,
Right.
like a funnel.
Appreciate the comment. Thank you. Any other comments?
Don't you think that could have been avoided if they would have sent out letters?
If you could come up,
telling
please. Yeah.
everybody, all the businesses and the people around there that there was this business going in there at that time. How whenever you put a business in, the surrounding places are usually told that this is going on.
Not necessarily, ma'am. That's not necessarily the case. But I can tell you when there is an alcohol license going on, they do have to post it and announce it. So, but not every business is required to make an announcement of what type of business it is. That particular business, they do sell alcohol, so there are requirements, and that they did notify it.
That
And
was
it's
just a thing that they were supposed to do.
right. That business certainly is one that sells alcohol, so they would notify the area around it, so people would know that, right?
Looks like our guests are here.
All right, it looks like our guests are here for their presentation. And we're waiting on you. Right here. Yes, sir.
Okay, we're discussing the little background on pioneers and how healthcare is going in the county. And I don't want to lose anything. I don't want to go into trade secrets, so I wrote it all down. Okay, and this is a background. In December of 2022, El Centro Regional Medical Center representatives attended a Pioneers Memorial Healthcare District Board meeting. There, they requested Pioneers look into the possibility of assuming care at El Centro Regional Medical Center to take over the obstetrical and the pediatric patient area and buy related assets due to their financial status. And this is when Scott, the administrator, the interim administrator, was around. At that time, facilities were letting go of departments that were real expensive to those facilities, getting rid of the debt. Since that time, there have been meetings between Imperial County healthcare stakeholders, including Imperial County, El Centro Regional Medical Center, Pioneers Memorial Healthcare District, and Heffernan Memorial Healthcare District. From these meetings, several points have been acknowledged, and they are: Imperial County has a high percentage of residents with low-paying governmental healthcare coverage, which severely limits the success of any healthcare system without assistance. The information of a single county-wide healthcare district with 2 physical locations may be the best format for success. However, this would require several steps. Notification and application for change must be submitted to Imperial County Local Area Formation Committee, LAFCO, which oversees boundary changes between special districts. And they're going to be very important. One single healthcare district would ultimately require the dissolution of Pioneers Memorial Healthcare District as well as Heffernan Memorial Healthcare District and the formation of Imperial County in the Imperial County Healthcare District formation. If the single county-wide healthcare district was successfully formed, assets and liabilities from 3 existing stakeholders would be absorbed. It would be non-competitive, and it would be elimination of duplication of services and resources. This would make it lesser expensive. If one single county-wide healthcare district was successfully formed, it would require a board that ensured representation from all county areas. Pioneers and Heffernan voiced concerns regarding the financial status of El Centro, as El Centro's debt exceeds its asset values. And the longer we remain this way, each month, more financial circumstances take place. Okay, at the end of 18 months, as university had indicated that they would go over and manage El Centro Regional, each month that passes times 18 months, can you imagine what the debt would be? And the debt is pretty high right now.
Mm-hmm.
Okay, so I think the last time I heard it was over 200 million. Okay. Pioneers and Heffernan voiced concerns regarding the financial status of El Centro. We did. Pioneers submitted such a LAFCO application, as stated prior, in February, and Imperial County agreed to support half of the cost. El Centro expressed concerns and withdrew from participation in this process. So it's been a little stagnated. Not much has been indicative, State legislation wants to circumvent now the LAFCO process, and if so, would limit community feedback, and that's not good. Pioneers continues to support the involvement in LAFCO to ensure the engagement of local communities and analysis of options that provide appropriate access to care and the maximum reimbursement from our government payers. Pioneers respectfully request public hearings in Imperial County about AB 918 to better inform our citizens due to the bill's very recent amendments and its impact on LAFCO and the process discussed at this point. To our CEO, has done a great job at Pioneers Memorial Hospital.
Thank you very much.
Good evening, everybody. Can you hear me okay? I've been talking so much that I can't even hardly talk anymore, which is, I'm not usually a big talker. Just to follow up on Nick's comments a little bit, I think it's important to note that Pioneers, a lot of what we've done, everything that we've done has been kind of as a result of El Centro asking for help. As Nick mentioned, they came down and visited our board December 21st of last year and asked us to buy their assets and to provide the services that they're providing today in their facility. And we said that we were interested in talking about that. It's interesting now, the legislation that was rewritten last night and came out this morning actually is legislating that we begin to have discussions about that and how we might put a transaction like that together. And again, I said, well, we don't need legislation for that. Come down and talk. We'll talk tomorrow. We can get through that a lot quicker than legislating them. But, and as the events have unfolded, they with their financial troubles, you have to make some tough decisions. They closed their OB program. They were losing multiple tens of millions of dollars a year there, and we didn't have much choice. They like to make it sound like that was a partnership deal, but they came down 7 days before they were going to do it and said, hey, we want to let you know that we're going to close our OB program. And we're like, we deliver 1,600 babies a year in our facility, and they deliver about 800. So we were going to 50% increase the size of our service to the community overnight within a week. And we asked them to delay that some. They actually wanted to close before Christmas, and they agreed to wait till July 9th. Because our biggest concern is it's tough to find staff in this community. And if we didn't have the employees to take care of those patients, then that was going to be a big problem for even our program. We might have had to shut down because you can only do so much with what you have. But they did agree to work with us, and we developed a transition plan. We hired about 25 of their staff. Brought them into our program, and it was not easy. Boy, our doctors and our nurses worked really hard, especially that first week, because you can't onboard staff that fast. They have to be oriented. We have different systems, those kinds of things. So that first week was really tough, but our folks stepped up and we got it done. And then most recently, the base station, which you guys have probably all seen too. We think that's an important service for this community. And even though we were struggling financially too, and I'm going to give you a little update on that tonight too, but we said, it's too important. We've got to find ways, and we believe that collaboratively we can find some help in the community. And the local health authority stepped up and contributed $200,000 to us for the first year to cover the first year costs of taking that on. And we're very appreciative of that. And we'll have a big community blowout. July 1st is kind of the target date for us going live with the base station. We want to make a big event out of that and bring our partner that helped us with a donation to the table and kind of celebrate a little bit. So it's been, that's really our focus. I think the last time I was here, I told you guys a little bit about myself and why I'm here. I was with the consulting firm that was asked to come in and help them find opportunities to improve their financials. And then they asked me to stay and help them implement those. And we're beginning to see success with that. The first 4 months, so July through October, Pioneers was averaging $2 million a month in loss as well. In the last 4 months, December through March, we've averaged a $700,000 a month income. We've made $3 million in the last 4 months. And we're still turning. We've still got a lot of work to do, but that was our goal. We want to be here for the community, and in order to do that, we've got to stabilize our financial situation. And a lot of that work is focusing on a lot of things that's really neat. It's a re-energized organization because we're bringing people to the table. We're doing ED huddles. The ED's our front door, and we have a lot of people coming through there, and it needs to work well. And so we've got an early morning huddle where all of the stakeholders throughout the hospital come together and talk about what's going on, what do we need to do to be able to get patients out of the ED up to the floor, those kinds of things. The physicians are involved, and that wasn't happening before. We all were in our own little silos, and you just don't really succeed when you're in a silo. But we've broke down those walls, and we're working as a team now, and we're getting better every day. We got a long ways to go, but we're getting better every day. And my goal is that we're an organization where our employees want to come to work. They want to be a part of us, because that then transitions into good patient care and a great place for physicians to practice. If our employees call in sick all the time or don't want to be there or we can't retain them, then that makes it hard to be a high performer. So we're working hard on all those fronts. So just a little bit, I wanted to talk a little bit more about El Central's numbers as well. They publish those. They're a little slow lately for probably various reasons, but their March numbers aren't out. But no matter how I look at their numbers for the last 8 months, which is through February, they've averaged $2.8 million loss a month. If I look at the last 3 months, it was a $2.8 million average loss. So they've lost $25 million so far this year. They're on track to lose $33 million this year. They lost $22 million last year. And that's kind of what Nick was talking about. That's a buildup of additional debt. It's not necessarily always going out to the bond market and getting debt, but their AP was $17 million at the end of June. It's $25 million today. So that's a problem that they're not making a lot of headway in solving, and that's a big problem. Not only the debt, but that gap in that performance. Even if you bought that facility, you'd have to fix that before you could provide health care in a way that's sustainable here. And for them, we know they're caught in a rock and a hard place. They took a lot of negative flack over the closure of OB. Fixing that gap is jobs, and I'm sure they don't want to face that. But that's a big issue for them right now. I like to always use perspective. I worked for an organization once that had a $20 million loss. That's why I went in there, is to fix that. But they were a $500 million organization, so that loss is pretty small compared to their revenue stream. That $33 million loss for El Central is on a revenue stream of $150 million. So that's a much bigger proportion of that total revenue stream, which makes it a lot harder to fix. So I think, some of the points that Nick made, that I think there's a lot of agreement in the community about. There should be one district. I think that makes a lot of sense. It's just a matter of how do we come together in a way that we can all work together. There's so many different factions and different things, and El Central's debt is a big one that nobody wants to touch. So I'm not sure how that comes about, but we do also believe that should be through a local process. We believe that if we have an application with the local LAFCO, that when El Central walked away, we told them to put it on hold. We wanted to be good partners and work through this stuff in a way that worked for everybody. We're ready to move forward with that at any point, and that may happen soon. But our first intent with that is meetings like this with the whole community. There's town halls everywhere. There's another health district. We need to talk to a lot of people about what should the healthcare model look like, and we need to engage in assessment that helps us with that. There's all kinds of different reimbursement things now that you can have rural emergency hospitals and different types of things that we might be able to do here, that when you put those pieces together, then you can bring in more reimbursement, as well as then if we can consolidate the two hospitals under one flag, there's a lot of duplicate services and things where we can lower the cost of providing care, which means if you do need support, it's a lot less. You know, I think that that's been one of the things we've been trying to make a point of as well, to legislate that we maintain and to just filling the gap of the operating problem that's happening up there now doesn't make sense to me. Why should we pay those kind of dollars? If we're going to put the healthcare system together in a way that then is efficient and as effective as it can be, it'll still need support, but that's a much smaller support. And I think that makes a lot of sense. So, but we want to make sure that we're talking to people and getting a lot of feedback on that as well. So I think that's all my comments, unless there's any questions or things that you guys might have.
We certainly appreciate you being here and providing that information. And, you know, we do have a representative with the State Assembly here who did present some information on the Assembly member bill earlier. And so it's just good to hear two different perspectives on that. And, you know, I don't have very many comments, but I do appreciate the information. I'm going to leave it to my fellow council members to provide their input and see if they have any questions.
Yeah, there's a lot there, so I don't intend in just this session to keep you here and everyone all night, Mr. Sorensen. But I just a couple of things. I'm going to have to agree that the thought that we're not going to legislate our way out of this long, developing issue. None of this is new. We recite this almost every time, and really, right now we're at a critical juncture, no question, as a region, as a county. So. I think the work needs to happen, and I think that's what you're saying, is that there are multiple stakeholders. A bill's not going to fix this unless the bill has a ton of money attached to it that's going to rain down on Imperial County, and I don't see that proposed. So I'm certainly with you on that, but just on just something like healthcare debt, a lot of people don't understand that, and it's obviously it comes with its complexities, but just so that folks understand, I reiterate this every time, like-kind counties like ours on borders and rural areas that do not have the same tertiary care centers that large metroplexes and cities have are all challenged with the same thing. When it comes to reimbursement, when it comes to aging, when it comes to things like payer mix, there's a lot of things that kind of come into this. And then to provide the type of service and the quality and the access that we all expect. It's kind of like if we leverage our strengths, which we do have some, and I think you already mentioned, a few of them. It really just comes down to local leadership coming together with our healthcare leaders, coming together with our legislators, so not leaving anybody out. I want to make sure our good assembly member understands that too, sir. This is really a multi-pronged, it's going to take everybody. And I think what you were saying is that LAFCO can help support that, as it does for things like boundaries, and if we're suggesting a larger healthcare district, that may be the solution, but what's the, I think as you're bringing up, what's the delivery system ultimately going to look like, and what is the business going to look like? So do you have literally a 1 minute, lesson of what makes it so challenging on the reimbursement side in a county like ours?
Well, I think certainly your payer mix is a big part of it. Medicare and Medi-Cal is close to 80% of the payer mix here. Mm-hmm. In all of the places where I've been in my career, that Medicaid, no matter what state you're coming from, has generally been, if you get up in the double digits, it starts to get high and make it hard. We're up around 40% here. And from what I've read, and this isn't, go research it, but I've heard that California is like 48 on the list of 50 for the level that they pay for their Medicaid piece. So that then again makes it challenging. So that's a big challenge, and it means you have to look at things different. You have to use your resources different, and you don't have the same resources to take care of people that you would otherwise.
Certainly. Lots there, yeah. And only, I guess, the follow-up to that on something like paramedics reimbursement and kind of our population, if anything, at the legislative level, and I know we've been screaming this from the mountaintop as a healthcare industry in California, why not dive into that and modify that and increase reimbursement? And I mean, that's the root cause, that's the answer, especially in counties like ours.
Yeah, absolutely. If you look at, the trend in healthcare has been to move away from inpatient into outpatient. Well, we still make money on inpatient, but we'd lose money on outpatient. I've never been anywhere you lose money on outpatient. The outpatient payment levels across the board here are just, they're challenging, very challenging.
Thank you.
Yeah, it's a tough job.
Thank you, Councilmember Warden. Councilmember Hamby or?
I'm just coming from a very, uninformed and simplified view, but Donnie took the words out of my mouth. I read an article about a hospital in the Central Valley somewhere, I think it was, that went out of business because I think the numbers it showed were 50% of their patient load was Medi-Cal, Medicaid recipients. And when I heard that our number is up close to 80%, I don't know how our healthcare districts have done what they've done as long as they have without going under. And so, exactly as Donnie said, I think that's where a lot of the outcry and the effort needs to be made, is that type of legislation. There needs to be more money. If this county and if California in general has such a high load of Medicaid patients and they pay the least amount, they reimburse the least amount out of almost all 50 states. It's that in a state that last year I think they said we had a $25 billion surplus. This year I think they're saying we're going to be $25 billion in the hole. So there's a $50 billion difference from one year to the next. I don't know, but that surplus, some of that should be going toward the medical system, because it's in an area like ours where they're always happy to, trot us out as the poster child for underserved communities so that they can get federal funding. It rarely trickles down to us. So I think that for sure our legislation should be focused on getting more money for our healthcare districts.
Yeah, and you all probably know there are some bills out there that are focusing on that. I think there's one that it's at 1.5 trillion more for healthcare. Well, that's like 1% of the state's total budget. So if they give that 1% to everybody, it's not going to help much. I think that bill ought to be places like this where we're heavier. Those low insured people ought to get a disproportionate share of that, because we need the help more than other places that have insurance carriers that then help offset that.
Yes, thank you.
Yeah.
Thank you.
Mr. Sorensen, you know what? I just want to publicly thank you for being down here. I know you came from Minnesota?
Michigan.
One of the M's, right?
Yeah.
I
lived in Minnesota well too, so you can't
I was up in Minneapolis, and they said, do not confuse us for that other M state. I was up there visiting a few years ago. So we definitely appreciate your expertise, your leadership on this. I'm in a really tough situation right now. Both of the leaders of opposing factions, right? Different ideas, both want same end goal, right? One district. And I guess I got myself caught in the middle of this conversation because I was so vocal, expressing the fact that we shouldn't take on that debt that El Centro has, right? And the fact that everything that they're doing down there, and we're well aware of plenty of mismanagement. Not everything is, what the state is handing down. We know about all the stunts they pulled in that hospital. We've heard of plenty, right? So we all know about the sweetheart deals here in the county. How many people just had their hand out? There's a lot of stuff going on, and not too many people want to talk about it. My concern is, and I wish you would answer, I know that this bill has specific timelines for when we have to get our act together, when we have to vote a board into place. And I understand, I think this is a third attempt locally at forming one district, and it's fallen apart 2 times already. What's different this time, and what are there any timelines, anything that would be different from this bill, or anything that would compare to this bill as far as getting this accomplished, and not just we're going to talk a lot, we're going to scream a lot, we're going to say, we save some money here, save some money there, nothing happens, and at the end we suffer here. Yeah. And I get all the other issues as far as the concerns that Councilmember Warren brought up, and we were well aware of some of that stuff, right? Him way more than me, but But we also know that there's been a huge, an inability for us to cooperate and work together. And it's only natural because you're in the valley, we're territorial. Everybody's like Brawley, and I want to have control, and I want to have this control. We haven't been able to accomplish this. So what's different this time? If you could help me out. I mean, like I said, I'm in a very tough situation here between Pioneers Board and a good friend, Mrs. Santillan, who I admire and respect and look up to very much, as well as the assembly member. But I'll admit to you that in private, I was screaming. Me and the assembly member had some pretty heated discussions about what was happening with El Centro, because we were concerned about, are they going to throw that out? Are they going to pass some kind of tax that we're all going to have to bail out El Centro? And so it was very heated. And, I think it's fair that we ask the same questions to this board is, how are we going to make this happen? When are we going to make this happen? Are we going to make this happen?
Yeah, those are good questions, and I guess I'm certainly not a prophet or anything, but all those issues are alive and well today, and your bet's as good as mine whether this can happen. I would be more optimistic if I saw parties looking at this from the perspective of what's best for our community versus what's best for me, and that's not happening. So until that changes, I don't know that you'll get there. And that's what I tell people at the hospital every day. When we're making decisions, that patient is what we're making the decision around.
Mm-hmm.
It's not about whether your department or your department should be getting or doing something. That patient needs something right now. That's what we're focusing on. And we got to do the same thing here. What's best for this community? And that's why from the day I walked in here, I wanted to make Pioneers healthy, because if we were in the same shape
Mm-hmm.
of El Central, nobody in this community would have a say or a
Be
peep
game over.
that they could say or do anything about. So as long as we're healthy, we've got that. And that's been our focus. But yeah, I certainly wish there was something that could, usually it takes a disaster or something to bring people together. I don't wish that on anything, but I have no magic answers for you.
Yeah, but you have been able to right the ship, so to speak, over the past 4 months, and so that you've said that it's become, you're not operating at a loss every month. So that's business 101. Nobody wants to go into business to lose money every month, and so that's very important. So without that, you can't provide the services. So, there's that optimism and I wish the process well, but there are obviously different opinions on the matter. And I just, quite honestly, I care about this community and I do understand that you can't provide services when you're operating at a loss for very long.
Yeah.
That is absolutely true.
Yeah, and I guess if I was going to prioritize things, the expansion of the district is certainly not number one.
Mm-hmm. Yeah.
The thing that's going to help this community's healthcare system the best is that you've got one hospital, two locations, but one legal entity, because then you can bring in a lot more reimbursement. You can begin to shave those costs in a way that make sense. And then you can put a district together and get some help financially that you have a better feel of what you really need. Right now, if you're looking at $30 million a year, well, I think they said if we expanded the tax that the people in the Pioneers Health District are paying today across the whole county, we'd get $10 million. That's a third of what they're losing down there. So we can't just fund what's happening today. So we've got to change what we're doing and make it work better before we even talk about what we fund from our taxpayers.
Interesting.
Yeah, and again, I certainly appreciate. We're seeing this. You're riding that ship, right? We've seen it since you came down here. I think when was your first presentation?
I started the end of October. I think it was December sometime.
I recall. I remember the numbers. I remember.
I wasn't here very long. I don't think.
Yeah, and that's part of it. What is your opinion on El Central? Will they continue to operate? I know they brought in revenue from other areas. What happens if they fold? What happens if they close the doors?
Well, that's why we would like to be working with them. And certainly the state may be able to do some emergency things, but you need two campuses to provide the facilities to take care of the people that need taken care of in this community. So what I understand, if they end up having to shut their door, it's a lot harder to get them reopened and licensed than it is if we can form some sort of a transaction that gets us together before that day. I worry about that every day. I don't know where they're getting the money to continue. We watch their financials every month. I know they've had some pledge support, but when we ask questions, the detail of that doesn't seem to make sense. So, I mean, I've heard them say that they've got money to get them 12 to 18 months down the road. When you talk to their bondholders in a meeting, they are not pledging enough money to do that. So where's it coming from? That loss isn't getting smaller, so where's it coming from? I don't know. Those aren't questions that I can answer, but when you look at the facts and the data that's available, it's questionable whether that's really happening.
I was referring more to Pioneer, PMH's ability to provide services, because I imagine we would be just.
Yeah, well, that's we would like to have that facility, but we're going to do the best we can. I think we have 106 beds between the two censuses. That's full house. So we could certainly provide the lion's share of the care in what we've got, but that certainly would not be ideal.
Mm-hmm.
Yeah. And the ED would be tough.
Yeah.
We've got they expanded the ED, so we've got a pretty vacant area right next to ours that we could open up and revamp and probably do a good job, but it would put a lot of stress on our system.
Thank you, sir.
Well, if there's no further questions from council or staff, we do certainly appreciate your time, your energy, your effort coming in, and I'm glad to hear that things within Pioneers are turning around for everyone's sake, right? And so I appreciate you very much. And I will compliment you, I think every time, or the 2 times that you've been here, been very impressed with your knowledge base and how articulate you are in explaining things, and it lays it down like I'm a layman and I understand it. I am in business, of course, too, but I'm not in that business, right? But I do understand operating at losses and not. And so
I don't take credit from that. Years ago, I was working with a nurse on some project, and you're developing something, and she took it home to her 5th grader and had him look at it and said, and they gave us some feedback. So that really kind of opened my eyes and said, you really do have to be sensitive to who you're talking to.
And I'm right at the 5th grade level, so I appreciate it very much.
No,
No wonder it makes so much sense. You know what I mean?
I didn't mean to imply that.
I'm kidding. I'm all right. I'm really at 6th grade level, but come on, it's all right.
Not quite there yet.
Yeah, it's all right. Yeah.
Well, thank you guys so much.
Thank you very much.
Appreciate it.
Thank you very much. I appreciate it. All right. Next, we're going to immediately go into closed session. We want to thank the public for coming out. Thank you.
Thank you.
Yeah.